Well, when it comes to our health, certain symptoms can be kind of difficult to talk about, even to your doctor.
Yeah, but doctors say not opening up is a real mistake. In extreme cases, patients can risk dying of embarrassment. Our own Dr. Frank McGeorge is here with the inside info. And doctors, there's some things that you and your colleagues want patients to know.
Oh, there's a lot of things, Karen and Damon. You know, this story was actually inspired by 3 people who shared with us that their illness could have been diagnosed and treated earlier if they had just been honest with their doctor about the symptoms that they were experiencing. To help you avoid that mistake, we asked 3 local doctors from different specialties to share their advice for patients who are just struggling to find the words.
Knock, knock. Nancy, can I come in?
For these doctors at Corewell Health Beaumont, it's a challenge they know all too well.
In urology, we see this a lot. We see patients who come in with problems that they think they're the only person who have it, and they're just like embarrassed to bring it up.
Dr. Kenneth Peters is the chair of urology. He says often patients with urinary incontinence don't feel comfortable sharing the whole truth.
I'll just say, do you ever have any leakage of stool? And sometimes it's just like the shock look on their face, like, yes, I've never told anybody this, but once you bring it out, then they're so relieved because at least they know that it's something that's actually happens and that, we could potentially help.
Sexual health is also difficult for some to discuss, says Dr. Lori Mausi, an OBGYN.
Sexually transmitted infection testing. It's hard to come out and ask for that. Some patients will think that they're dirty or think that I think that they're dirty.
But that's far from the case.
There's nothing that I haven't heard. I'm not here to judge you. I'm only here to give you the best care that I can.
It's a sentiment shared by family medicine Dr. Asha Shahjahan.
Something like hemorrhoids is very embarrassing for patients, but as a doctor, I see that so many times a day. It's very routine for me. And you'll be surprised as a patient that once you do share what it is that is embarrassing for you, that the doctor doesn't even flinch. They're like, oh yeah, we can take care of that.
Some patients are also hesitant to discuss depression, anxiety, skin rashes, and obesity. But not bringing up sensitive topics limits your doctor's ability to properly care for you, and it can have devastating results.
I did have a patient that had a large mass in their vaginal area, and they did not want to share that. And it was just through an exam that I was like, wait a minute, what is this? How long has it been there? And it had been there for almost 2 years, and it turned out to be cancerous. And that was something that I said, why didn't you tell me about it? And she was embarrassed.
So how do you find the words? Well, these doctors say write them down.
Write down the top 3 things that you want to talk about. And if it's embarrassing, maybe preface that. Say, Doc, I'm kind of embarrassed about this, but this is what I have going on.
Did you have something else that you wanted to discuss with me?
And try to avoid waiting for that doorknob moment to share your concern.
We're reaching for their doorknob, saying goodbye, and then they'll often say, well, one more thing. And it's like they finally kind of get the courage to bring something up. Men, it seems common, they may be coming in to get their prostate checked, and then as you're walking out, well, I've been having trouble with erections, and then it's like, well, okay, how long has that been going on? What have you done?
Whenever possible, find a doctor you feel comfortable being open with.
I want you to get all of the benefits that you can so that I can take care of you the best that I can.
And try not to beat around the bush.
So you want to be honest with your doctor, and honest in the simplest way. Sometimes it's hard to say things, so you kind of skirt around it, and then the doctor's like kind of confused on what you're trying to say. So be direct, be honest. That's what the doctor's there for, is to help you.
But these doctors stress, whenever you bring it up and however you bring it up, bring it up.
This is what I've trained for. This is where my passion is in medicine. So I just want to give you the best health care. But in order to do that, you have to be honest with me too.
I really wish, patients would not be embarrassed about anything. More often than not, the problems that they have, somebody else has. They just don't know because nobody's talking about it. Patients should know that we've heard everything, and there's nothing that you could tell me that would shock me.
That's our job. That's what we're there for. We're there to help you with any symptom that you have, and you don't want to minimize those symptoms because then it could harm you.
Now, our conversation with these doctors was just so interesting. We actually couldn't fit it all in the story. So you can hear much more of their advice and experiences right now at clickondetroit.com. They truly have heard everything. Also, tomorrow at 12:30, Dr. Lori Mausi will be joining our Christine McDonald on Daily Plus to share how she helps patients feel more comfortable opening up.
Yeah, I can only imagine that some patients don't want to feel like they're being judged. But is this something that you run into in the ER as well?
Oh, I have truly heard everything. That is the truth. But often by the time someone gets to me, the thing that they've been avoiding just can't be avoided anymore. But I often do have to ask some extra questions to get the information that I need, or something surprising might come back on a lab test that the patient was clearly already aware of. Bottom line here is, you and your doctor, you need to be partners in your care, and part of that partnership basically means trusting them with the full story, even if it might be a little embarrassing to share.
Right. Doctors respond so calmly. They really do.
And we have heard everything.
Yeah, I bet. Yeah. I'm
Well,
sure.
that's what HIPAA's for, too, right?
Right.
Is that you don't have to worry about your doctor sharing it with everyone.
We do go out of
privacy.
our way to protect
Right.
patient privacy, absolutely.
Thank you, Doc.
Thank you.